Fun fact, I am actually not a nurse. So thank you so much for asking. I feel so flattered every time I am asked about being a nurse or infection control nurse. I feel so incredibly flattered because I'm not. I actually have my master's in public health, and so I do have a background clinically as a volunteer EMT. Shout out to my former rescue squad, Clinton Rescue, Station 45. So during my master's program, I was an intern for the health department. Now, this here was during the Ebola craze. And based on my background as a volunteer EMT, I was very familiar with doffing PPE protocols. And so as an intern, I had to make a protocol for Ebola for the state as a project. So I did a really good job. And then during my grad school that same year, towards the end, I was hired on full-time by the state for their HAI team, so their healthcare associated infection team for the state. So I became the HAI epidemiologist. That's always a tongue twister. So I was there for around 2.5 years doing their ICAR program, which was the Infection Control Risk program through CDC. And now this program here was grant funded, so every year I had to write the grants. It was super stressful because my income was not always guaranteed. If I had no grants, then I had no job, and I couldn't pay my loans from school. So super scary if the grant did not get renewed. But that journey, oh my goodness, guys! Like, I toured the state of Florida, assessing programs for infection control and Ebola preparedness. Super amazing to link my background as a EMT with my training in public health. Fast forward, I was scouted by a health system on LinkedIn. Pro tip: keep your LinkedIn immaculate, because that's how I got found by my current health system. Then I became their infection preventionist for that system. I built their entire infection control program from scratch because it was a new facility. And now I work for the same system, just for a different service line. And I'm opening up a brand new hospital with this team, and again, making my own infection control program. Super duper exciting.